Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Valvular heart disease and its causes. So the causes can be divided into two categories. One is stenosis and one is regurgitation. So first let's move on to the stenosis. So here in stenosis, it can be due to the rheumatic fever. So it can be due to the R fever, that is the rheumatic fever. And next it can be due to the congenital factors and then the degenerative diseases. So it can be due to the rheumatic fever, the congenital, and then the degenerative diseases, as well as the presence of the SLE, that is the lupus. Then we move on to the regurgitation. So under the regurgitation, there is the rheumatic fever. So RF, rheumatic fever, and then it can be due to the congenital causes. Next is the IE, that is the infective endocarditis, then the syphilitic iotitis, then the trauma and the myxomatous. So there's trauma, there is myxomatous. Then comes the Marfan syndrome. So in stenosis there is very few. There is a rheumatic fever, congenital, degenerative diseases, as well as the SLE. So in regurgitation we stopped with the Marfan syndrome, and then on continuation there's a HOCM, as well as the tumor and the hypertension. Just to recap, we saw the rheumatic fever, the congenital, then the infective endocarditis, the syphilitic iotitis, the trauma, the myxomatous, the Marfan syndrome, the HOCM, tumor, and the hypertension. To learn and grow daily like this, please do subscribe.